The day someone learns they have cancer is life-changing. A threshold has been crossed, and the race is on to learn everything possible to understand, adjust, and hopefully become a survivor. That's where this man comes in, Dr. Michael Jones, chief of the pathology department at Maine Medical Center. He's been leading the fight against cancer from the cellular level for over 20 years, and most patients haven't even met him.
Many of us like to stay hidden, frankly, in the office, looking into the microscope.
Out of sight, but not out of mind with one of his patients, Amanda Hansen. She was looking for answers to her own cancer story.
My way of getting more information, which is kind of normal for me, was to seek out, the experts. And Dr. Jones certainly is that. They never really get to see patients.
To Amanda and other survivors, the pathologist is an unsung hero in the fight against cancer. Except for Amanda, these women have never met their own pathologist.
I met all the doctors who were involved in developing the treatment recommendations for me, but for the pathologist.
Out of the whole gamut, that's like the one person you don't really have an immediate access to.
Maybe this is the way that he is able to contribute significantly to the life of a patient without maybe having to be face-to-face in what is an exceptionally difficult situation.
Technology is helping Dr. Jones and others see patients more than ever.
I think the fact that we're doing much more real-time multidisciplinary care now has provided a venue for the pathologist to sort of get out, if you will, of the office.
Recognizing Dr. Jones hopefully will educate that cancer isn't like the swine flu. It's not, a virus, one virus. It's basically an individual disease.
The big thing that's happening in pathology now is molecular genetics. Our field is getting revolutionized. All of medicine is getting revolutionized with molecular genetics.
And survivors are learning more about what happens inside the walls of pathology and recognizing the impact.
Gratitude, just thanking them as a result of a wonderful oncologist and other medical professionals using the information that pathologist provided. I'm doing fine.
What they had to work with was a very small sample, and yet they figured it out.
Because of their work, I think I'm still here. Many women are still here.
I think sometimes for some people, and I've found this a number of times, it helps them come to grips with their disease if they actually see it under the microscope for real.
For now, this leading pathologist, known for his love of fly fishing, looks to the future.
In fact, I think the day will come when we'll be holding on to cells or pieces of tissue from virtually everybody with cancer. And because nowadays in research we have some extremely powerful tools that's really furthered our research efforts.
And if you're lucky enough to run into Dr. Jones in the hallway, he's got a joke for you.
How do you tell an extroverted from an introverted pathologist? The extroverted pathologist looks at your shoes while they're talking to you.